Hi, folks. Jack O'Malley, and here with a Wednesday update. It's been a crazy couple of days. Lots of stuff to talk about tonight. Monday was kind of quiet. Today, a little bit different. I want to start with some good news, and that is the budget. Some good news there. Revenue sharing money to the local governments and also to K through 12 looks like it's going to be stabilized and no cuts. The good news is that last revenue sharing conference we had in August showed that the hit to our economy and taxes, the money that funds all these programs, wasn't hit as bad as we initially thought. As I've heard, one of the big reasons for that was the federal CARES money, the unemployment money that went out, especially to the contract workers, the gig workers. That was huge. That was money that they normally wouldn't have had. The stimulus package was a good thing. It appears that money was actually a positive. Sometimes the federal government can do things and it's money just tossed away, but it appears that this time it actually worked because people had money and they spent it. And that keeps the taxes going. So that's good news. Negotiations have been based solely on the revenue estimates outlined a month ago. Budget Director Chris Kolb said the targets will fund key priorities such as education, healthcare, and skill training. This has been a year unlike any other, said Senator Jim Stamas, who chairs the Senate Appropriations Committee. Chair Shane Hernandez chairs the House Appropriations. But Senator Stamas said, the unprecedented challenges Michigan has faced meant that working together, Republicans and Democrats, and the legislature and the administration was absolutely essential. This agreement means a fiscal responsible budget will be in place in time for the fiscal year. And then Representative Hernandez, Chair Hernandez, said, even in the most challenging of times, we are coming together to protect the top priorities of Michiganders, including students and schools, and the essential local services people in communities across the state rely on every day. And this is good news. Now, exact details aren't all worked out yet because how the appropriations works, the leadership has agreed. Now it's been spread out to the subcommittees in charge of all the different things, and they're working on things. So it'll come back, I'm assuming right now that next week when we return to session, there will be budget bills before us and more details on what happens. But the main things are education and local revenue sharing. Looks like they're stable from last year. I don't think anything's going up, but the good news, at least in those areas, things aren't going down. So more on that next week, but that's the good news. And we'll have it in time for the end of the month, which, of course, satisfies our Constitution. So good news there. Another thing I wanted to talk about because we're coming up on it. Okay, just make sure I had all my notes together. We are moving to an election here on November 3rd, and there's been a lot of questions about mail-in balloting. Now, here's a couple things I think we got to kind of get set and just. This is, again, I always say this. This is how I see it. You can agree or disagree, but this is how I see it. Mail-in balloting and absentee balloting. They're really two different things. We still refer to it as absentee ballot, but an absentee ballot is the old style. Mail-in balloting is the new style. Now, whether you like it or not, the people of Michigan voted 2 years ago and put it in place. All right? So now the question is, are we ready? Have we put all the, all the safeguards and everything in place? Some will argue no. Some will say, who cares? Just go. And that's a problem that I do see with our Secretary of State. She wants to go. And there are a lot of things. Our system, this is a changeover, right? And so the systems that were there in place might not be everything we need for this new system, which is now the law, but two things that have made it a little harder to transition. One, the volume because of COVID. I think the numbers of folks mailing in there and asking for a early ballot would have gone up anyway, but throw in the COVID, it goes up even more. Then you've got a Secretary of State who, in my opinion, you can agree or disagree, who is pushing this hard. Why? We can all speculate, but I think she's pushing it hard. And I think that what we need to do is somehow make this all work. So There's been some legislation that moved through, went through the Senate. It'll be coming to the House. And basically what it says is absentee ballots or mail-in ballots, the early ballots, they will arrive. The question is, how long will it take to process them? Well, some have said, well, it should be able to go on forever, and we should be able to accept mail-in ballots for, a couple of days after the election. I disagree. If you don't have your ballot in by election day, that's on you. All right? Now think about this. If you're going to go vote, you got to get up. You're going to do it the old way. You walk in, you go in, you stand in line, you vote. It takes a process. So now I'm okay with the mail-in because that's the law, right? But if you are going to exercise your right to vote, God love you, you have to exercise some responsibility too, and that's to make sure it gets there. So if you get your mail ballot, your absentee ballot as we call it, and you let it sit on your countertop for weeks, and then it's like, oh, I got to get it in, and you got to wait a month to get, in case it doesn't get there in the mail. No, that's on you. When you get your absentee ballot, your mail-in ballot, fill it out and mail it back. Give the mail several weeks to get there, or you can take it to your clerk and hand it in ahead of time. You can do that. All right. So that's huge on you. If you're going to mail in, God bless you, but it's on you to make sure it gets there by the due date of election day, right? Simple. Sorry. I won't budge on that because you have a responsibility to get it in. You can't just say, well, I sent it in. It was 2 days ago and it didn't make it. And that's somebody else's fault. You got a responsibility. Sorry. The other thing that's important is this legislation says that clerks over a certain size, I think it's 25,000 municipalities, can start to process those ballots the day before. I think it's 10 a.m. to 8 p.m. they can do it. Now, here's what they can do. That ballot comes in 2 envelopes. There's the mailing envelope, and then there's the secrecy envelope, which the secrecy envelope has your ballot. They will be allowed to open the main envelope and take your secrecy envelope, this is a pretend secrecy envelope, and sit it there. So that the next day, on election day, they can take the tab off and count your ballot. If that tab is removed ahead of time, that ballot it doesn't count, as I understand it, because it can't be removed until it's ready to vote. So they'll be able to take all the ballots that come in, open them up out of the mailing envelope, but the ballot stays in the secrecy ballot envelope until it's time to run it through the machine or however the system works in that community. Okay? So that's the system that's in place. Is it going to be perfect? No. But remember, this is the first real big presidential election. Things happen, all right? And it takes time for the system to work. Everybody's learning. So I don't believe our Secretary of State should be pushing as hard because we need to adapt the system. There's a lot of people that have been doing a great job for decades, but now they've got a brand new system with more ballots coming in because of COVID and the law. So I think we take a logical, safe, sensitive approach to this and move forward. I think we'll be all right, but we have to make sure that the safeguards are in place or it ain't good. All right? So there you go. I want to talk about our COVID committee. Emergency management. We had a great hearing, and I'll talk more about that on Friday, okay? Because there's so much to talk about. So yesterday and today, we had the COVID committee, and yesterday we had the ombudsman, which I didn't even know we had one, for long-term care and nursing home. So if you have issues with that long-term care or nursing home, there is a state ombudsman who can help you. And I will post later the link to that website so that if you have an issue, whatever it might be, we do have an ombudsman that will help you. It's free of charge. So I think that's a good thing to know. So the question is, obviously, everything that has to do with nursing homes. I'm going to just talk about me and what I experienced. So there's lots of questions and the panel going back and forth. And Director Gordon is the head of Department of Health and Human Services. He's been in before our committee before. He was in today talking about nursing homes. And I asked him a question because he showed stats that said, hey, you know what? Michigan's done great. Our numbers aren't worse. They may be better than how other states on how we handled the situation of nursing homes. So my turn. I said, Director Gordon, I appreciate you being here, but I got to ask a question. I said, there's a lot of mumbo jumbo, a lot of terms and things. I said, I'm a simple guy. I represent my people in my district. And the question I get asked, and please explain it to me in as layman a terms as you can, because people don't understand it. Why did anybody put recovering COVID patients in with the most vulnerable? Can you give that to me in layman's terms? Forget the charts. Just explain it to me so I can explain it to the people back home. Didn't really do it very well. So I said, okay. I said, let me ask you this. Another question that's always brought up is, how do we check the number of people who die from COVID? Because the CDC said, hey, folks who die of COVID, there might be other contributing factors. So how does the state? And I had several questions that I wanted to ask him about that. Again, tell me so I can explain to my constituents, right? Well, he deflected to, well, that is better asked for, I forget the term he used, and they're coming in next week. Things like that happen. So here's what I thought. The thing that really ticked me off about that was in earlier sessions that we've had with UIA, with labor and economic folks, the LARA folks, how many times did we ask these states people, well, why'd you do this? Or what was, well, that was a public health thing. You'll have to ask DHHS. Okay. So we get the director of DHHS in, and I ask him a question, and he says, well, I really can't answer that. You'll have to ask somebody else. That's bull. Now, I realize the director of DHHS has got a lot going on, and he might not have the exact detailed answer to a question that a stupid little rep from the 101st might have. But he should know enough to answer the question and say, you should ask them for more detail. He didn't. He dismissed it. So I get, and think about this, I hear all these agencies say, you got to ask DHHS. And when I ask DHHS, he won't give me an answer. He deflects it. That's the problem people have with state agencies, and particularly this one. And the other thing, I'll be honest with you here. I'm just your representative. I'm telling you what I saw. I understand that Director Gordon was asked some tough questions, maybe even questions he didn't like from other members. I don't know. But I tried to be respectful. The point is, I thought his attitude was one of contempt. And you know what? I get he's been busy. I get he's got a tough job. But I got a job to ask questions, and so do the other representatives on that panel. Our job is to ask him. Senator Lasada asked him, well, when you were putting these people into nursing homes and you finally set up a task force, why didn't you set up a task force earlier to look at the problem? Because there seemed to be a problem. A lot of people were bringing it up. And his answer was, I guess we were busy. Director Gordon, I know you're a busy man. I'm busy too. People of Michigan deserve answers. My job is to ask those questions. And I thought today, you answered some. You showed a lot of charts, but you deflected a lot too, and that bothers me. So when this epidemiologist or whoever shows up, I will ask the question about the death certificates because you wouldn't answer it. But remember, there is an old saying that I believe a president of the United States coined, the buck stops here. You are the director of the Department of Health and Human Services. You should have had answers today. Maybe not the complete answer, I get that. But you should have had answers and you deflected them. And that is not good. I know you're a busy man. I know you were even probably a little pissed at us today because we asked you some tough questions. But tough taco. It's your job. All right. Some of you will agree with me. Some of you will think I'm a horse's patoot. I can live with that. Have a good night, everybody. We'll talk about emergency management and anything else that's popped up between now and Friday. All right? Have a good evening. Good night.